So we're seeing a patient today that had a recurrence following an EVLT. This patient came to see us and she had some signs of venous congestion. She had all these what we call coronal phlegmectasias, and we realized that she had a recurrence of her right great saphenous vein insufficiency coming from what's called a perineal vein. She had a little atypical source. Women get this all the time. It starts back here and it came into the great saphenous vein and reopened it, and all the reflux started again. So we did an EVLT and we treated that source with sclerotherapy. So today she's just following up. We're just going to show you what a post-EVLT follow-up typically looks like. So obviously we examined the leg. You'll see there's always a little bit of bruising, but it's usually pretty simple. There's not a whole lot of things. Patients are sore along the segment that's been treated with the EVLT, and that usually lasts 7 to 10 days, the first couple of days being the worst. So on follow-up, we're going to check a few things. First, we want to make sure that she doesn't have a blood clot. So we're going to check her common femoral vein. So as I mentioned, she'd had a previous treatment. This is the junction of the right great saphenous vein with the common femoral vein and the femoral artery. We're going to check this junction. That's where we worry about a blood clot. So we're going to look at the flow. So you can see that there's flow as she's breathing, which eliminates a blood clot at this junction, or at least gives us a first positive sign that there is no blood clot. So right common femoral vein. We're going to go down the femoral vein. So everybody's aware of the technique to determine if there's a blood clot in a vein. We freeze the image and we come over and we compress the vein. So you'll see that the pressure in a vein is 7 to 12 millimeters of mercury, so it's easily compressible versus the femoral artery, which won't compress. So that is the typical initial way of making sure there's not a blood clot. So you can look, make sure there's no intraluminal material, and compress, every inch or so. And when we get down to the obturator canal, this gets fairly difficult. Patients don't like us pushing on their leg at that level. So we're going to just do a last picture here to document. So, that's her right femoral vein distal. We are going to go around and pick up the femoral vein where it changes into the popliteal vein, which is behind the knee. So we will see both her popliteal vein. We can confirm that. You'll see that she has her femoral artery and her popliteal vein. So we are going to freeze our image. We'll do the same thing. We will compress. You'll see the vein that compresses, the artery again, which remains patent, right? Popliteal vein. That's the initial thing. We can also look at these veins and get a little better image and make sure we're not missing anything, but as you can see, everything looks good. So now let's go back. As I mentioned, she'd had a recurrence. So this vein had actually been treated, a right great saphenous vein, and was closed. There was maybe a little small tiny vein that you can see here, but her vein actually came back right about here. We see this frequently. So this is where her vein came back, and you'll see there's a perineal vein that came down from the pelvic area, came into her great saphenous vein, and there's also a posterior thigh circumflex vein which was going on. So we treated the great saphenous vein with ETA, or endothermal ablation. So that's closed all the way down here. We'll take a little picture. That's her right great saphenous vein. We'll put proximal. And we also treated her popliteal vein with ECA. So we injected this vein. So you can see when I push on it, it's closed. That's her posterior thigh circumflex vein. And we may need to actually go back and look at this little perineal vein, which is very small. You can barely see it here. I'm sorry, I'm jumping around all over here. But some of this is a little hard to see. So there's a little tiny perineal vein that was in this area right there. That does not, well, it does appear to be closed. So we'll watch this and make sure that she doesn't get a new source of reflux from this perineal vein that comes in and opens this back up. So the next thing we'll do, you'll see we've closed her great saphenous vein all the way down to here or farther. She had some branches coming off this that we'll treat. She has a right SA that we started the treatment on. You'll see that's closed at the source. And then we're going to go down her leg and we'll end up treating her great saphenous vein all the way down. That's why she has this cluster of small spider veins. So that is a post-EVLT ultrasound verification to rule out a DVT and to confirm ablation of the vein. And when she follows up, we'll stand her up and we'll pick up where we left off, and we'll be able to treat the veins distal to what we treated.